Good afternoon, everybody, and welcome to today's session of Cafecito entre Nos. Today we have as our guest Dr. Richard Cervantes, who will be presenting on Familia Adelante, an EVP to support parents and strengthen families. You'll learn a little bit more about him soon. If you want to share with us how you're feeling today and where you're coming from, we will be happy to get to know you a little better and see how you're feeling. We have some energized, calm, thoughtful, some tired, overwhelmed, focused, mostly calm, doing okay. Thank you, everybody. Thank you for joining us again. We would also love to know where you're coming from. So if you can share in the chat where you're joining us from, that would be great. We have Texas, New Orleans, Houston, San Diego, Kansas City, Puerto Rico, Indianapolis. Welcome Toledo, Chicago, Rhode Island. So from all over, North Carolina, Idaho. Thank you all. So for today's session, we have simultaneous translation. So if you want to listen to the presentation in English, you can go to the interpretation tab on your Zoom panel and click English or Spanish. Para escuchar la presentación hoy en español, puedes ir a la pestaña de interpretación en el panel de Zoom y hacer clic en español. También se puede silenciar la voz del presentador en inglés haciendo un clic en silenciar audio. So, a few housekeeping items as well. Today's event is being recorded and will be made available publicly through our website and other media channels. For today's presentation, participants will be muted. Since we're having a dialogue with Dr. Cervantes, you'll have an opportunity to ask questions and speak with him. So we'll let you know when we can open for questions. We can do that during the presentation and also at the end. Please make sure that your computer speakers are turned up and on to hear today's presentation. If you have any technical issues, please send a message to us, to the COE on the chat box. If you have questions, as I mentioned, you can share them via the webinar chat, and also we'll let you know when we are open for questions. You have the PDF of the presentation available. Once we complete the webinar, the session, please complete the evaluation. This is very important to us, as this is what allows us to continue to do the work that we're doing. As you know, we are self-funded, and part of the requirements for us to continue is that we share the evaluations of our events so that we can continue to offer them. As you see on the chat, we have shared the links for evaluations. We have them in English and Spanish available for all of our audience. Also, you will receive a certificate of attendance a week after today's session. So, as you know, we're the Hispanic Latino Behavioral Health Center of Excellence, and our mission is to advance and support the sustainability of behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment, and multiple pathways of recovery support for Hispanic and Latino communities. Okay. A summary of Familia Adelante, a multi-risk prevention intervention program for Latino families. So, Dr. Cervantes, if you can share with us a brief summary of the program.
Sure. Thank you very much, Daris. And it's a pleasure to be here today with all of you. I'm very excited to be here with many providers and prevention folks that have interest or that are working with Latino families. So we want to keep this kind of an informal conversation. Some of you are familiar with Familia Adelante, some of you may not be familiar. So I want to just kind of keep the conversation rather informal, but I do want to provide information for you about our program. So if we can go to the next slide.
Actually, the next slide is your bio. So So we'll do that. So for those of you who don't know Dr. Cervantes, he is Research Director at Behavioral Assessment, Inc., and a Senior Research Fellow at Long Beach Center for Behavioral Research and Services and Department of Psychology. At California State University, Dr. Cervantes has published numerous journal articles as well as over a dozen book chapters relevant to Hispanic, Latino, youth, family, mental health, and health issues. He is the developer of the Hispanic Stress Inventory, a self-report instrument to assess culture-specific life events stress experienced by our communities in the US, and Familia Adelante, a family-focused prevention and intervention program. He has years of experience in the conduct of community-based and evaluation and is familiar with necessary multidimensional evaluation methodologies needed in community and applied settings. He has served as principal investigator of numerous NIH and foundation funded studies over many years of his career. And also, I would like to point out he's a long-term friend of our center and collaborator. So thank you. Next slide.
Thank you, Daris. So again, it's a pleasure to be here and with good friends, good colleagues that I've worked with for many years at the Center of Excellence. Today we're going to talk again about Familia Adelante. We're, as everybody knows, we're in a period of time that's very challenging for providers, for people that want to access services, for familias that may not know where to get services. So it's kind of a challenging time right now. We're out of the pandemic, obviously, but we still face some of the pandemic-related issues that were present and that have affected children in many different ways. So Familia Adelante, when we talk about a risk reduction program, we're talking about a program that supports families to help children, help families, help parents, caregivers reduce risks. So that's what we're talking about. One of the things that we know is if we can reduce risks like family stress, family conflict, school-related stress, if we can reduce those risks or help youth, help parents become more resilient in the face of stress, that reduces their overall chance or their risk of moving into a mental health issue or moving into substance use. So a lot of the risk factors that we're going to talk about today impact both substance use and mental health, so behavioral health in general. So let's go to the next slide.
The next slide. How did this come about? How did you identify a need for such a program?
Thank you, Daris. Well, this goes back a long time. As you all can see, I have pelo gris, gray hair. So I've been working in this field for many, many years. Um, I was a young psychologist working at UCLA and working in the area of culture and stress. One of the things that we learned is that uh, stress is quite different for Latinos than it is for other populations. We have our own unique challenges. Psychology in general, back in the day, did not really recognize those challenges or those kinds of stressors. Through a series of studies that we did at UCLA and then later at USC, when I was on faculty there, we were able to identify through research some of those cultural factors that are important that impact kids and families. I wanted to take it one step further personally as a psychologist, and I know there are psychologists and counselors out there when we work one-on-one with our clients. Sometimes it seems like, we have long waiting lists, we have people that want to see us, and we just can't serve as many people or families as we would like to. So my original thinking right? How did Familia Adelante come about? Is that if we could design a program to reach children very early when they were young, much younger than we might see in a clinic, work with kids who are showing early signs and symptoms of a behavioral or emotional problem. And if we could put all those kids in a group and take them through a manualized curriculum-based program and include their parents, because we know when we work with Latinos, we have such strong family values, strong family uh, connections, that it's important to work with the full family. So again, all of these ideas came about early in the development of Familia Adelante, to put together a program that works with kids who are very at the very beginning sign or symptoms of behavioral or emotional problems, work with them, work with their parents, and to create a curriculum, a model that could be used by basically community health workers, not just counselors, not just psychologists, not just psychiatrists. Because we're very, if you look at the data on psychology in general, they're less than 5% of all of all PhD psychologists are Latino. So we're still have a very low number. If you're, probably in this meeting, we have, uh, you know, a,
Most.
yeah, we have most of the psychologists and psychologists and counselors that are Latino in this meeting. So we're
And
very limited. So
so
that's,
that
go
means
ahead.
that by including promotoras or community health workers, you increase access for communities and families. Um,
Exactly,
right.
exactly. We can
So
go ahead.
you were saying that you started with young children. How young?
We work with children starting at age 10 and 10 up now up through high school age.
Perfect.
The original program was designed for 10 to 14-year-olds.
Okay. Thank you. So we have more information there. There we go.
Yes. So who Familia Adelante serves, typically Hispanic or Latino families, kids 10 to 17. Uh, we often focus on at-risk or foreign-born Latinos, right? So the program really addresses a lot of those issues for people that are newcomers. Um, our program provides youth and their caregivers, families with techniques to overcome the risk factors and stressors that I'm going to talk about in a few minutes. One of the most important things that I mention always when I'm doing the training, our culture, or Latino culture in general, we have a lot of strengths. We have a lot of resilience. How can we, as psychologists, counselors, community health workers, promotoras, how can we pull or mobilize those resilience, those cultural strengths? How can we do that when we're doing our work? So Familia Adelante, and when I do the trainings, we really emphasize, we want you to be able to mobilize the strengths that are inherent in our cultura, in our families, and let families sort of use those strengths. For example, um, ethnic identity. We know that ethnic identity is a very powerful resilience factor. It's a very powerful strength that we all have. We sometimes in families we lose that. We lose our sense of who we are, our culture, our identity. So in Familia Adelante, it gives people an opportunity to strengthen their cultural identity, to value their identity, and so we support the strengthening of cultural identity in our family. That's one example of how we mobilize strengths, how we mobilize resources within our communities. So back to this description of the program, it is a group focus program. So we work with the 10 to 17-year-olds. The groups are focused typically about 10 youth per group. So we can serve a lot of kids at one time. Um, the group discussions aim to increase parents' perceptions about their role in protecting their adolescent or their kids from risky behavior. So we provide a lot of parenting tools, a lot of parenting education, a lot of techniques for parents to kind of help manage their children's behavior.
So you already mentioned a few of these, but what are some more of the components of the program?
Thank you, Daris. So the components really involve our outreach. So we typically do outreach, and some of the sites that we're working with currently do outreach in schools, do outreach in faith-based settings, do outreach in community health settings, outreach to mental health service providers. So outreach is a big part of what we do, letting people know that this program is there to help kids, help families, help to improve children's, behavioral issues, academic issues. So outreach is a big component. We also do a little bit of screening. So when let's say a school counselor refers a child to our program, there's screening that we do to ensure that they're eligible for the program. There's no cost typically. I mean, everything costs, but to the families, we like to provide the services at low cost or no cost out in the community. But we do that screening to make sure they're eligible. Um, they do not have to have a DSM diagnosis to participate in Familia Adelante, right? We just
Mhm.
want to make sure that the children are having some level of stress that the program can help with.
So
So
you, mhm.
no licensing required to do the program. We do certify our trainers. So if, for example, there's let's say there's a play site in St. Louis, Missouri, and they want to do Familia Adelante, they would be trained, and a handful of promotoras or providers would be trained and certified to run the program. So again, the program is for groups of about 10 to 12 per session. And we have a total of 12 sessions that we provide throughout the program period.
Okay. And you mentioned um, risky behaviors and risk factors. Since we have the slide here, can you mention some of those?
Thank you, Daris. Yes, these are very important risk factors that are unique to our culture. So these are culturally focused risk factors, right? Things like cultural adaptation stress or adaptation gap. So these are for children, right? For the ones that are on the screen. Um, Cultural gaps are when children and parents are really separate from in terms of their cultural orientation. The children might want to be very, very much Americanized, and the parents may want to stay more traditional. When we have that kind of a situation, we call that a cultural adaptation gap. Also, culture and educational stress, and we give you some examples here. Kids have told us, that my teacher thinks I'm cheating when I speak Spanish. We have a lot of those kinds of issues going on in the school settings that are very important for our kids. Relocation related stress, right? When families have to relocate, leaving people behind, either in a different town, different city, or different country. So relocating. We also know that for kids, community and gang related stress is really important. It's very, very much an issue, especially in larger urban areas. Um, kids are being recruited into gangs, or there's a lot of gang-related stuff going on in their neighborhood. Those can be very stressful for some of our kids. Can be very scary for some of our kids, even to get to school and feel safe. There are some other things for kids that we talk about, like discrimination stress. This particularly, again, within the school setting. These things bother kids. They're quite disruptive for children. Family and drug-related stressors. So if you have a family member, with a drug problem or legal problems, many of our kids are in families where parents may have been incarcerated or are currently having legal problems. That affects children in a very negative way. Family relocation stress, again, when a family or a member of a family moves away or is moving from a different town, different city, different country, that can create stress for our kids. And
Mhm.
finally, economic stress that affects, kids across the board. But a lot of our kids are living in the poverty, under the poverty line, and so even um, issues around buying groceries, being able to afford now with gasoline prices the situation we're in right now is really affecting a lot of the families that we talk to.
Yep.
So
Yep.
all of these things affect kids, and the more of these stressors that kids experience, see, the higher their risk is for substance abuse or having a mental health issue.
Mhm.
So in Familia Adelante, we want to, number one, make sure that we talk about these issues in our groups. Number two, that we help children to create resilience or strategies for coping with these stressors. And number three, that there's a family approach to doing all this. As you're going to see from the next set of slides, there are a number of stressors that affect parents as
Parents.
well.
Mhm.
So, and again, these are, a lot of these things are based on some of our studies that we've published. But for parents, again, family and cultural conflict within the home. For example, when, children prefer to speak English when the parent wants to speak Spanish, that can create conflicts. Again, discrimination issues, profiling in the community, people being disrespected in public settings. You've all heard the stories, we hear them daily. Health-related stress for our adults. This is a big, this is a big thing, especially since
We had a bit of a connectivity issue, but we're back. We can see you and hear you.
okay, good. So we left off talking about health stress, and then I think there are some other ones that we have on the next slide. And again, these are some of the things that affect our parents.
Those are the ones we have for parents. And you spoke a little bit about this, but how you spoke about engagement, outreach, uh, training of promotoras. How is the program implemented? Ay, sorry.
Okay. So if I'll just kind of follow some of these bullet points, but the groups are led by trained community health workers or other behavioral health providers, as I mentioned. We provide that training and certification. Trainings are provided to organizations, so we train like community mental health centers, school personnel, etc. Familia Adelante offers a safe space for youth and families to share these stressful life experiences, sensitive issues, and family problems that they might be experiencing. We help parents and youth normalize their experience of cultural adaptation through the facilitator. So each promotora is running, if you can imagine the promotora running groups And I know some of you that are on the chat or in the presentation today are actually doing those groups. So the promotoras run the groups, give an opportunity for parents and youth to talk about some of these stressful things. And we help families and youth develop coping skills. There's a lot of what we call mutual group problem solving. Cultural resilience is relearned. Again, we're promoting cultural identity, cultural strengths like familismo is a very important concept that we work to strengthen in our program.
So, what would an example be when you speak about developing coping skills? And would the group do some sort of role playing? Do others share what has worked for them? And that's the type of dialogue and dynamic that goes on.
That's correct, that is.
Mm,
So
mhm,
we have a manual that's provided to each trainer or group leader, and they go through for each week. There's a set of goals, objectives, and activities. So each activity is processed or gone through, and there's a lot of role playing, a lot of problem solving, and a lot of group interaction. We want to help people. One of the things that we know with our families, one of the reasons kids get stressed out is because they don't have an opportunity to communicate. So we're trying to help them communicate, teaching them how to talk, communicate about feelings. We do have a separate component on mental health,
mhm,
depression, anxiety, how to recognize those signs that we're teaching kids how to sort of know if they feel depressed or anxious and who to go for to get help. So developing a trusted adult that they can talk to, helping them identify who that person is part of what we do in these lessons. But it is a lot of role playing, a lot of problem solving, and a lot of sort of group dynamic that we do in those sessions. All and it's fairly easy. The manual is fairly easy to follow, right? So
mhm,
we developed it that way, almost like a school-based curriculum,
mhm.
like a class curriculum. So it's kind of a step by step for each of the sessions.
And you mentioned identifying resources and who children can reach out to. Um, if there's an additional need identified, for example, psychotherapy or something like that, the program offers also a way to connect to those.
Correct.
Mhm,
We always make sure that the promotoras know what
mhm,
their limitations are, right? Since this is what we would call a prevention or early intervention, if we have a child that, for example, becomes suicidal, or if we have a child who indicates there's domestic violence at home, or there's a child that indicates perhaps they're thinking about running away. Um, there's a certain level of clinical issues that our program is not the best for. So we always make sure that there's a mental health specialist, a licensed personnel available in the event that those kinds of issues come up.
mhm.
And that's part of the training that we do for organizations is to make sure they have those linkages or develop those linkages.
Great, thank you. We will some of the sessions here that we can share.
Yes. So these are some examples of our youth sessions. So session one is an introduction. That's where we're providing the kids with an understanding of the program, the curriculum, its purpose, and why they were referred to the program. And we talk about evaluation. As Darius mentioned, all these programs have to be evaluated. We got to show that they work. So we highly recommend that an evaluation is conducted as part of Familia Adelante. That happens in our first session. Session two is concept building, talking about prevention, talking about cultura, talking about some of the concepts around cultural adaptation and family stress. Session 3 and 4, we really get into helping kids verbalize and learn how to talk about their feelings, learn how to talk about stress, learn how to express what's going on at home. We also have a youth workbook that we give to kids. They take that home. It's kind of like a journal, but there's some activities in the youth workbook that help them kind of reinforce some of these concepts. Session 5 is all about cultural adaptation and stress. What does it mean to be Hispanic or Latino in the US? What are some of the challenges or issues or stresses associated with adapting to the dominant culture, mainstream culture? 6 and 7, we talk a lot about school, the kinds of stresses that kids have at school, including bullying, negative peer pressure. We've also included a lot of information about dating and intimate partner issues and about internet.
Mm-hmm.
So talk a lot about social media, the upside and downside of social media, and what are some of the things that kids can be mindful of when they're using social media. Session 8, family stress. We get into talking a lot about family stressors and helping kids learn ways to deal with those stressors. Gang, we have a gang prevention night for kids. Sometimes we'll have somebody from the outside, like a probation officer or a gang expert, come in and do that lesson, as well as session number 10. It's all about substance abuse education. We have a lot of information in our curriculum manuals on both of these issues, but sometimes we like to bring in or recommend that we bring in somebody that's an expert on substance use, or perhaps somebody that's an ex-drug addict that wants to come in, that's in recovery and to talk about their experiences. Week 11 is a really powerful night where, remember, we're doing the group separate. So the parents are over here and the kids are here for 10 weeks. In week 11, we bring them all together and we have a special set of activities to reinforce family communication. And that's done at week 11. Week 12 is more of a graduation. We give certificates. Sometimes we have a potluck. It's just a time to celebrate with our familias. So that's covers real quickly the 12 sessions of the Familia Adelante. Each session is about an hour and a half, and sometimes these are done in schools, after school settings, faith-based facilities, community centers, that kind of thing. This is for the parents. We have a similar set of sessions, an introduction, as I mentioned, and then we go right into parenting education. Lessons 2 and 3, we're helping parents learn specific techniques for raising children, for providing positive feedback. A lot of our parents, unfortunately, are coming themselves. They're coming from households that uh, really there wasn't a lot of positivity. There wasn't a lot of expressions of love or caring in those families. So we have to kind of help the parents work through what that means in their own families. How can I praise my child? How can I help say something nice to my child instead of, using very punitive language all the time? So we help parents and in some cases help them design a behavioral management plan that includes a lot of praise, a lot of positive reinforcement. So we do use some psychological principles there in sessions or parenting skill training in sessions 2 and 3. In session 4, we get into talking about stress in general, how that affects our parents, some of the effects on their physical and emotional health. Session 5, we're talking about stress, but from a cultural adaptation perspective. Again, what does it mean to be Hispanic or Latino in today's mainstream culture? And all of you I'm sure you have your own images of what that's like right now. So I'm not going to go into to a lot of examples, but right now we'll say there's a lot of challenges that our parents have in adapting to the mainstream culture. Session 6, we talk about economic and occupational stressors and try to help problem solve around ways to cope with economic stress. Session 7 is more parental stress, parenting issues. One of the things that we see a lot in our familias is that the parents have disagreements, cultural perspectives, cultural disagreements about how to raise children. You might have one parent that wants to be very, very traditional and another parent that's more, if you will, Americanized, right? So they're two different parenting styles. So here in session 7, we try to help them communicate, verbalize those kinds of differences in their own families and come up with ways to reconcile those. Session 8, again, is family stress, family-related issues. 9, we also talk about gangs with parents and help parents increase their awareness about negative peer pressure, gang affiliation, right? And to identify signs that their kids might be joining or interested in joining a gang. I see there's some questions coming up, Daddy, so I
Yeah,
guess should you want to take those now or you want to
there,
wait?
there's one I want to share
Okay.
from Josette Reyes. If a child is participating in the youth group sessions, does the parent also have to be a part of the parent group session?
Yes, if the youth is participating, we want at least one parent or caregiver in the adult parent session. If they are older, and we have a new modules for older kids now 15 to 18, where we only work with the kids, the high school age kids. Parent participation is not required. So, and that's just because of developmental issues and what we've learned in working with the older age kids. But for the 10 to 14-year-olds, yes, we do want parent participation.
And also, are there two facilitators, one for parents and one for youth, or do you have one facilitator
We
for both
have,
groups?
once you are trained, you can do either group, either parent or child. If you have the resources and staffing, we always like to have two people in each of the groups.
Mm-hmm.
So two people running the youth group and two running the parent. Two people running the youth group is especially important because of some of the kids have behavioral problems. And so just kind of keeping that in check is important. One facilitator going through the lesson plan and the other one kind of monitoring children's behavior. The parents, we found that one facilitator is typically good.
Okay.
So two for the kids groups and one for the parent.
Mm-hmm. Okay.
And
So, mm-hmm.
go ahead. Do we
You
have
were
another question?
not right now.
Okay.
Oh, we're going to the next section. You mentioned Familia Adelante is more of a prevention, early intervention program, and the purpose is to reduce risk for both substance and mental health disorders. So, in your studies, what has the effectiveness that you have found for Familia Adelante?
We have many different studies that we've shown. Familia Adelante is an evidence-based practice, has been approved by the California Department of Healthcare Services, the Use Integrated Substance Use and Addictions Program, and SAMHSA has listed us in ways as an EBP. We've shown in many of our studies improvements in family communication, improved perceived risk and harm of substance use, improved youth coping skills and stress management skills, and reduction or delayed initiation of risky behaviors. one of our studies, we've also shown reduced anxiety, reduced hyperactivity, and improved academic performance. So we do have a lot of evidence and a lot of different publications related to these findings. And as I always mention to people, fidelity is really important. So as long as you use the program and follow the manual, you're probably going to get the same type of results that we have gotten in our own studies.
Mm-hmm.
In our signature study with 105 families, this is a while back, but I think still relevant. We found reduced past 30-day drug use, increased perceptions of harm, alcohol and other drugs, reduced conduct disorders, reduced learning problems, reduced hyperactivity, and reduced anxiety for youth. And in the parents for this study, we found an increased knowledge in substance abuse and HIV transmission.
Excellent. We have another question. Could you speak a bit more about any existing longitudinal evidence or effectiveness, if you have that, and what our outcomes were measured?
Let me talk about the longitudinal. So this study that you're looking at on the screen was a 9-month study. So we did pre-assessments, uh, post-assessment at program exit, and then a 9-month follow-up. So all of these results are based on that 9-month follow-up and that's again 105 families that participated. In a new study that we're getting ready to publish, it's about 130 youth, high school age youth. Again, we followed them for about a year and we found no increase in any substance use category. We found improved perceptions of risk and harm associated with substance use. And we found reductions in risky behavior, especially in the intimate partner relationships. And that study will soon be published. But again, that's with our high school age kids.
Mm-hmm.
In the
We
terms of the measures, we typically, when we do our evaluations or our research studies, we've used some of the different SAMHSA measures of substance use, 30-day past use. We use the Connor rating scale for parents. We've used the youth self-work, the Achenbach tool, and we've used some HIV knowledge and awareness questionnaires that we've developed in-house for those assessments.
Mhm.
I hope that answers the
Yes.
question. Yeah.
Yes, we have additional results, and I'll go after this. I'll go to another question that we have.
Right. This is the one that I was mentioning to you in the older age group in the newer study. So reduced and delayed initiation of alcohol, reduced and delayed initiation of cannabis, which is a big issue for us in Southern California, Los Angeles. Reduced and delayed initiation of tobacco use and illicit drugs. In terms of substance use, generally, there was improved knowledge and improved attitudes and beliefs around substance use. So this is a newer study that is soon to be published.
And this is a newer study with the older group. Does that mean it includes the modules with social media information and intimate partner violence?
Yes,
Perfect.
all of the sessions, all of the programming that we do now includes information on social media for both parents and youth, as well as more information on for this particular group, more of a focus on intimate partners.
Mhm. Perfect. So we mentioned this, a bit earlier, but there's a question, maybe we can speak about it some more. Do you discuss suicide or suicidal ideation thoughts attempts during the sessions? And how do you work with the youth and their parents if someone discloses suicidal thinking?
Great, that's a great question. Um, we make sure that we train our promotoras and community health workers or counselors to recognize when they hear anything about suicidality or self-harm or other harm, that youth is seen individually. So we will ask that particular youth to wait after the group, and or if we have two facilitators, to step outside and do a little bit more of an assessment privately. If the suicidality risk is really high, and we sort of use that Columbia index to assess that. If it's really high, then we like to get them referred out immediately to a provider. We also make sure that, because the parent, ideally the parent is in the next room, right? So that we bring the parent and child together and have that conversation together. Same thing if there's a domestic violence episode. We have to inform and we have to break that confidentiality at that point.
That was my next question. If there was a disclosure of domestic violence or sexual abuse from a child, then you would do the same.
Same thing, yes.
Mhm. Thank you.
It doesn't happen a lot, but it does happen occasionally.
Mhm.
I'd say probably in some of our provider groups that are with us online would know best, but it's probably 1 out of 100 youth that has an issue like that.
Thank you. We have a couple more questions. Thank you. Could you speak a bit more about the main mechanisms thought to have mediated in the reduction of health outcomes?
I would say the main mediators are improved resilience and coping skills, reduced cultural-based, adaptation-based stress, um, improved kind of self-awareness, if you will, and improved communication, family communication skills. I would say those are the primary mediators or the mechanisms of change in our program.
Mhm, mhm. Being culture specific, how do you think that also mediates in terms of sense of community, sense of belonging? You mentioned ethnic identity. You think that
Correct.
strengthens that and also
Mhm.
contributes?
Yes, absolutely. So that self-identity and ethnic identity and this sort of notion of mobilizing our cultural resilience, all of that's very important. We don't have great ways to measure those things yet. We can measure using the Hispanic stress inventory, we can measure the cultural adaptation stress, and we've seen reductions in that over time. But we don't have a great way, to talk about increased cultural identity or strengthening cultural identity as a result of our program.
Mhm,
What we like to do in our program is to make it okay, to make it acceptable, and to support and to help families value their cultural identity and their cultures of origin. So we think that makes a big difference. Many of our families, when they complete the program, they want to continue because
mhm,
they've established that sort of extended support network as well. We haven't looked at that in any of our studies, but that would be an interesting, if we have any graduate students online, an interesting thing to take a look at.
mhm. Okay. Thank you. We have a couple more questions. Being that Familia Adelante is a prevention program coming from a child protection services perspective, a lot of our Latino families are involved due to the lack of understanding or education on U.S. laws and culture. Do you believe that Familia Adelante would be a helpful tool to use with Latino families that are already having contact with CPS?
Absolutely, because we do, again, we have so much emphasis on familismo, on parenting skills, uh, child behavior. So this just kind of helps strengthen, especially for parents that really never had an opportunity, or parents that they themselves grew up in families that were sort of um, not functioning that well.
Mm-hmm.
So it gives them an opportunity to kind of take a step back, learn some new skills and strategies for how to manage their children's behaviors. And I think we've had this program in operation in different locations where a lot of the referrals are from DPS. I know one of our programs in Houston, they got a lot of referrals from probation and Department of DCFS, Department of Children's Services.
Mm-hmm.
This
Okay.
slide is another example. I don't want to go into a lot of detail, but it's just another independent evaluation that's being done, continues to be done in the state of Arizona. Um, I can mention that as part of our training, we've now established two training hubs, one on the east for the southeast, 5 states in the southeast, and now one in the southwest. This particular slide is coming out of our program hub site, training hub site at Amistades Incorporated in Tucson. They have had funding from the Arizona Parents, the Governor's Parents Commission on Drug and Education for a number of years, and they really have been using our program throughout the southern Tucson school district with a lot of success. And these are just more validation that, our program helps to improve family cohesion, improves attitudes towards substance use, improves youth knowledge about risks and harm of alcohol substance use, improves parent-child communication, and parental involvement in children's activities. So this kind of gets back to that question about child protective services and families that have been referred. This particular independent evaluation, which is ongoing, by the way, has shown improvements in this involvement in children's activities, which is really important. And we
Thank
get really high ratings. This study showed 99% satisfaction with the program, and all the parents stated that they would recommend the program to sell. So some of these soft evaluation indicators are very positive for our program as well.
you.
But again, we do have new training hubs, one in Charlotte, North Carolina, and one in Tucson. Charlotte is run by the Center for Prevention Services. And again, the one in Tucson is run by Amistades, which is a nonprofit organization in Tucson. More of this information, you can find on our website.
And I'll ask you to share the website and your email. I know there are some of our participants are interested in possibly implementing the program in their organization. So we'll do that a little bit later on. Our next
Sure,
slide has to do with the virtual program, and I know we have a question on that. So hopefully, um, we can
sure.
share some information.
So let's talk about the virtual program. The pandemic was hard on everybody, and everybody had to sort of pivot quickly. We had many, many sites that were doing Familia Adelante in person, right, which is the standard operating procedure, but they needed to be able to reach families, you know, um, um, virtually through Zoom or meetings. We created a 9-session version of Familia Adelante, which is also available. And for those that get trained, we train you on how to use the virtual lesson plan. But it's the same type of format. There's a total of the 9 sessions. We still work with parent and youth groups, also conducted by the trained paraprofessionals with licensed supervision if possible. Parents, all of our programming is available in both English and Spanish. Everything that we do. And all the manuals, the materials, the youth workbooks are all in English and Spanish. We found that the virtual lessons work well for kids in this 6 to 8 kids per group. And this is just sort of a breakdown of those virtual sessions. You can kind of compare it to the one I showed you before, and a lot of the material is the same. It's just done virtually, as if I was now running a lesson for, if you all were parents, I would be running the group pretty much the same way, using a PowerPoint slideshow, slide deck, and going through these lessons with you. From concept building, parenting ed, stress management, cultural stress, cultural adaptation stress, economic occupational stress, family and parental stress, gangs, and substance use. All of these, the material, the information is very, very similar when compared to the in-person version of our program. We had collapsed a couple of the sessions because they were sort of overlapping. And we took out our first session, remember the orientation or introduction. So we recommend that that be done virtually with each individual family, that evaluation and screening. And also the last session, number 12, actually number 11 and 12, because 11 was family night, if you recall, bringing everybody together. You can't do that on the computer. So we took that session out, and also the last session, which was the graduation.
Graduation. Mm-hmm.
Yeah, so that got us down to the nine virtual lessons. But again, this is available. Some people use this, some sites use this in a hybrid way. They use some of the slides along with the in-person format. And I know groups in Houston have done that. I think Amistades in Arizona has done some of their programming in that way. So it's just kind of a different option for you.
Thank you. I hope that answers the question. Um, Related to the virtual program, we have a couple more. One that is in part related to the results that you shared earlier. Our participant says this is such a relevant topic. Thank you. How do you make sense of the delayed initiation in cannabis use and the long-term presence of these mediators?
Um, that's a great question. I think it's a research type question. We know from different national surveys, like the National Household Survey on Substance Use and Health, and the Monitoring the Future survey, which, by the way, and substance use rates are going down for kids in general, including Latino kids. So this is a good thing, um, as well as alcohol use. But we know from those studies that if you can get kids, you know, into programming at certain transition times, like the, between elementary school and middle school, if you can work with them at those in those periods of times, and because they're very stressful times, if you can work with them, support them, provide them with this kind of intervention, and delay initiation. Every year that we can delay the initiation of a substance use reduces the overall risk that that child is going to fall into a drug use pattern. So if we can delay a 12-year-old from trying marijuana until they're 13, or a year old delaying that initiation until they're 14 or even 15, we have a pretty good chance of making sure that they're not going to fall into a substance use or a cannabis use problem. So initiate for prevention programming, very important for those of you that really work in the prevention field. Delaying the initiation of any kind of risky behavior, including substance abuse, should be a goal for all of us.
Thank you. Thank you. That makes sense. Um, you mentioned a bit about this. How do you get parents or families on board with the programming?
How do we get them on board?
You
Great,
mentioned outreach. I think that.
great question. Again, we don't want Familia Adelante to be like a punitive, like a punishment. So even though we do get, school referrals from counselors or teachers that say, okay, this, Juanito's having some problems, paying attention in class, or Juanita, we saw her, with an older, making out, with an older boy. So we think she would benefit from your program. Usually the parents are more than, willing. I've only seen a couple times where parents would reject or deny that their kids need the program. Well, once the parent gets involved and they know that there's an issue with their child, they usually want help. So that's motivation in and of itself for them to join our groups. Um, some of our programs provide, of course, food, because in a lot of our communities, there's especially if it's an after-school program, kids like to eat. They need things, something to drink, something to eat. Parents appreciate, not having to cook. So if we can provide them with something, a light meal, healthy meal, um, that always helps as well. Parents look forward to that. Any other kinds of incentives to participate. Some of our sites that are resource rich, right? They can provide incentives, financial incentives for participation, or for incentives for participating in the evaluation. So just think about what kinds of incentives are important in your community. What do families in your community need, and try to find a way to make those available, or to use that as a way to promote the program.
So you've had positive results in terms of engaging families, parents, children. You find that reaching out to the community, finding out their needs are, and some
Yes.
incentives. Okay, perfect.
And you know, and again, working with schools, working at multiple levels, working with the schools, working with the community-based organizations, working with parents, working with the faith-based community. I know one of our programs has, especially now, and this is one of our programs, and hopefully I'm not speaking out of turn, but I know one of our programs that's being run in Charlotte, North Carolina, they actually recruit families at the food distribution centers.
Mhm.
That's their, and they've been getting a fantastic response from parents that, are there to get help with food giveaway, but at the same time, they need help, managing their kids. So that's been a really nice way to do that outreach. Every community has a different, you just kind of have to think out of the box, how to make these sessions accessible and available for our familia. It's very important.
We have a few more questions. And you mentioned evaluation, so again, we'll invite our audience to complete the evaluation. We have been sending the link for both the English and the Spanish version, so we would love for you to take a few minutes to complete the evaluation, as that will allow us, as I said, to continue to do the work that we're doing. We're almost at the end, but we do have a couple more questions. We spoke a bit we spoke about referral processes. Is there a timeline established in terms of disclosure? And I mean, states have their guidelines for those. Do you have a timeline for referrals in cases of suicidal ideation or disclosures of violence?
Um, well, immediate, it needs to be immediate. We're all mandated reporters, so um, I don't recall if California still has the 24-hour time requirement. Yeah, all states have a pretty tight timeline in terms of mandated reporting. So check with your own state or your local county in terms of the timeline.
Mhm.
But I say right away.
Yeah. Um, One of the sessions for the parents, it includes information on STIs, HIV. I saw specifically, and sexual behaviors. Is there a space to speak about pregnancy and initiating sexual relationships and things like that with
Yes,
both groups?
there's
Okay.
plenty of space for that and for the parents, teaching parents how to talk about reproductive health with their kids is part of the parenting session, parenting module, but also with the kids in several places we role play intimate partner relationships, refusal skills. Um, um, we do for the older age kids, when I say older, 13 and up, we do recommend that the information on HIV be provided, the HIV transmission and how
Mm-hmm.
to stay safe. And that's for both the parents, because we have a lot of single parents also that are also themselves at risk. So we want to make sure that they stay protected as well.
Thank you. I want to mention a comment. In Charlotte, North Carolina, with the Center for Prevention Services, we have been implementing this program for a couple of years already. Our Latino families at risk are very thankful to participate in the program, and you can see the difference at the end. They want to learn more, and more importantly, they're engaged and utilizing the tools provided with their own families.
There you go. So thank
Um,
you.
there's an interest to implement in Puerto Rico and other places. So I am sharing the slide with your information so participants can reach out. Otherwise, they can reach out to us and we'll be happy to coordinate as well. Um,
Mhm. Thank you
uh,
so much, Laris.
thank you.
Also want to mention while you're filling out your evaluations that we are planning to have our Familia Adelante Practice Summit. It's going to be our first one coming up in October. I think it's October the 3rd. It's a Friday. It's going to be virtual, but you're all invited to participate, and we are going to send out that save the date to the COE that they can distribute to people that have been on this webinar. So just something else to keep in mind if you are considering implementing the program, you want to learn more about it, or you want to hear from people that have implemented it, that practice summit is going to be a good opportunity to do that. I'm also available at any time to talk about our training. If you go to our website, you'll see some testimonials. There's a lot of videos on there about from different sites that have implemented, and we're just so pleased that we can provide this to the comunidad, to the las familias that are in need, because there aren't enough programs out there, and there aren't enough of us to do all the work for everybody that needs something. So this is just another small way that we think, we can increase access to a behavioral health service.
Mhm. Thank you. Thank you, Dr. Cervantes, and thank you to our participants. We're very happy to have been able to do this session, and we hope that we'll continue to do similar ones. We'll be happy to share the information for the summit coming up. And since most of you or all of you are on our listserv, you'll be receiving some of this information. So thank you. Have a great afternoon.
Gracias. Thank you very much.
Gracias.